Hello, everyone, and a warm welcome to today's webinar. My name is Stephanie. I'm a Global Medical Affairs Lead at Nestlé Nutrition and Health, and I'll be your moderator before handing over to our speaker. Today's topic is creatine, new insights for muscle, bone, and brain, and we're delighted to have Professor Darren Candow with us. He'll be sharing the latest perspectives and evidence in this area, and we'll leave time for questions towards the end. Before we begin, I'll quickly run you through a few practical points so everyone can participate easily. So a few quick notes on how to use the webinar platform today. If you like, you can switch on the translation or language feature so you can follow along more comfortable. Please choose the language of your preference. For questions, please use the questions section on the right-hand side. At any point during the session, feel free to submit them as they come to mind. You may also be able to vote on questions, which actually helps us prioritize what we address then live at the end. You are also going to see a couple of quick polls during the session. If you have a moment, please do participate, as it helps make the session more interactive, and we are going to touch upon the results at the end. After the webinar, we'll share access to the resource materials, and we'd really appreciate you completing the feedback form, which is also needed if a certificate of attendance is being required. So before I introduce our speaker, just a brief disclaimer before we begin. Today's session is intended purely for educational purposes. And without further ado, it's my pleasure to introduce today's speaker, Professor Darren G. Candow from the University of Regina in Canada, Director of the Aging, Muscle and Bone Health Laboratory, and he serves on the editorial boards for Nutrients, Frontiers, and the Journal of the International Society for Sports Nutrition, ISSN, where he is as well as a fellow. And he leads research on exercise and nutritional interventions to improve aging, musculoskeletal health and function. He has published over 100 peer-reviewed publications on creatine and is therefore the right expert to give the speech today. And I'll hand over to you, Professor Candow.
Thank you so much, Stephanie, and the warm invitation, and welcome to everybody attending. And I'm very excited to talk about a very hot topic. I think everybody's interested in. It's having a moment. It's creatine, and I thought one of the best ways to title this is New Insights into Muscle, Bone, and the Brain, with a focus on healthy aging. So a lot of people will go back to the basics, Creatine 101. We're actually, as we sit here today, we're actually producing it in two areas of the body. One will be focusing on the liver and actually in our brain, which will be the latter part of the presentation. Creatine is not a steroid. It's a naturally containing compound that we can consume in our diet, but it's naturally being produced in our body from essential and non-essential amino acids. So when you eat protein-containing foods, we are getting a little bit of creatine. And I think most people are aware that it helps maintain the energy currency of our cell. It's called ATP, or adenosine triphosphate. And this molecule is used for any movements of daily activity, from walking to gardening to exercising. So the theory is that if our cells have more creatine, could it help maintain energy in the cell longer? That might allow you to do more work. And of course, the inception of creatine supplementation, it was discovered in 1832. But it really didn't get to a lot of promise or momentum until 1992, when young males primarily wanted to get bigger, stronger, faster. So we're sort of going to shift the mindset that creatine is just for young individuals. We're starting to see evidence that it has a global application for individuals across the lifespan. So the sources of creatine, because today's focus is on creatine supplementation, but it is important to talk about where we get creatine through dietary sources. So it is found primarily in habitual dietary patterns, but there is a bit of a caveat. So anybody listening that's a vegan or vegetarian or emphasizing a plant-based diet, there's going to be a little bit of a nuance. So creatine comes in flesh. Just like our bicep or quadricep has creatine, so do animals. But it's only going to be coming from red meat and seafood and poultry primarily. But here's the big issue, I think, from a sustainability application. To get as little as 3 grams of creatine, or about a half a teaspoon, you would have to eat an entire kilogram of codfish. If you went down to beef, you would now get 4.5 grams in an entire kilogram of beef. So financially, it's very expensive. What if you're vegan, vegetarian, the ethical treatment of animals, whatever your reason, it's not impossible to get creatine in the diet, but it's likely more difficult than most people think. So that's why we think when we talk about if you need a little bit higher dose or what's more practical, we get into supplementation. Now, I've talked about creatine so far, but when I talked about creatine supplementation, I'm only going to be referring to this specific type. This is the original form of creatine. It's called creatine monohydrate. It has the highest safety profile, and it definitely has the highest efficacy profile there as well. So whenever you hear me use the word creatine supplementation, I'm only referring to creatine monohydrate. To summarize the 3 areas that we can get creatine, we just talked about through the diet. You can also take in supplementation form. And the last part is we're naturally producing a little bit, about 1 to 3 grams in the liver. And then we'll talk about the brain a little bit later on. But that's it. There's only really 3 areas that are logical to get creatine into the human body and accumulate. So I think when we get into dividing up the presentation, we're going to focus on muscle, and this is also lean tissue mass or sort of body composition, and that'll include muscle performance. Then we'll piggyback into a segue of interest for bone health, and then we'll end the presentation primarily focusing on from the neck up cognition, which is a very hot topic, and then look at the safety profile there as well. So when we refer to muscle, or I'll just go back a little bit, referring to muscle and lean tissue mass, they're not interchangeable per se. When you see any evidence about lean tissue, I want you to now start thinking that about 50% of lean tissue is muscle. So, you know, if you increase lean tissue mass by a kilogram, about 500 grams of that is muscle. So this is a very popular MRI picture of the upper leg. And you can see at the younger age, we have a very, very strong femur. The bone density is very strong. It's very difficult to break. Then, of course, you have the precious yellow. That is muscle. And then is everybody's favorite, subcutaneous fat and intramuscular fat around that. And unfortunately, what happens as we get older, we go through something called anabolic resistance, or we're all familiar with biological aging. Unfortunately, bone mineral density and strength does go down. So now the limb bones primarily are more susceptible to fracture. Sadly, though, we do lose muscle. And then ironically, we do put on more subcutaneous fat and, of course, more visceral fat. So can creatine hopefully maintain the left side a little bit more often? That's what we're hoping. But let's look at what the research suggests. So we were very fortunate to do a very recent meta-analysis. There's been a few other individual studies performed. So when I talk about a meta-analysis, that's taking all the individual studies together to increase statistical power. So it gives a little bit more robust conclusions. And we started to look at 22 studies in individuals 50 and above who were randomized to creatine monohydrate supplementation or placebo. But the big kicker, and this is important for the rest of the presentation, that resistance training was added, because we think resistance training has to be a foundational piece for a lot of the creatine research to be effective or reliable. And this is kind of interesting that if you engage in resistance training for a minimum of 5 weeks, 2 to 3 times a week, and you consume creatine supplementation about 5 grams or more on a daily basis, the research suggests that those individuals will get a greater increase above training alone by about 1.2 kilograms. So remember a few slides ago, I said half of that is muscle. So at the end of the day, creatine is not only stopping muscle loss in older adults, they're actually starting to get an increase. So for those healthcare professionals working with individuals with sarcopenia, one of the main diagnostic criteria is a reduction in muscle mass. Resistance training has to be there. And now by simply adding another tool in the toolbox in the form of creatine supplementation, it's likely to have a beneficial effect at improving not only lean mass, but likely a small increase in muscle. It's not a super large increase, but there it is, an increase nonetheless. The main driver, what we think with an improving lean mass, is resistance training. And this study from Brazil by Bruno Gualiano's group, one of the world's best research labs from a clinical and health population perspective, they kind of populated and substantiated the importance of resistance training. Because in this study, they gave 3 grams of creatine on a daily basis to a very large cohort of postmenopausal females for 2 straight years. Okay, so everybody listening say, well, this must work. The issue is they gave no weight training. So all they did was ask these females to consume 3 grams of creatine daily without exercise. And even over 2 years, there was no change in lean mass. In other words, for those taking creatine, you have to weight train to get a noticeable and applicable increase in muscle mass. So forget creatine for right now. If you want to improve muscle health, weight training or plyometrics or any weight-bearing exercise has to be there for the long term, and then adding creatine will give you a slight greater beneficial effect. To go into a little bit more scientific information, so the previous 2 slides used DEXA scan, and some individuals listening probably said, I went to my doctor in the hospital, I laid down on this big bed and it was like an x-ray. So that's sort of a gold standard for measuring bone mineral and lean tissue mass. But we wanted to go a step further and use CT scanning, which provides a more in-depth, high-resolution image of the lower limbs and bones. And this was an interesting study where we looked at 1 year of supervised weight training. But notice the dosage of creatine. This is one of the first where we gave a little bit higher than normal. So this is 0.1 gram per kilogram of your weight. So if you're 70 kilograms, that individual got 7 grams a day. If you're 100 kilograms, they got 10 grams a day. And by using CT scanning in the lower limb, we actually showed now, in addition to previous studies on lean mass, they got an improvement in muscle density, which is a surrogate of muscle quality. So those that are taking a little bit higher dose of creatine, on average, it was about 8 grams a day. This improved muscle density in the lower leg. But those on placebo did not experience an improvement in muscle density. Is this even important? Well, it is, because by improving muscle density, that has been correlated with a reduction in falls and fractures a little bit later on. So again, we're seeing accumulation of robust evidence suggesting that the addition of creatine to weight training is beneficial. I think if you were to ask me what's the best reason that we would take creatine as we get older, yes, muscle mass and lean mass is important, but I think strength is a little bit more important because it leads to functional independence. And happy to report, when you look at all the studies that have looked at creatine in addition to weight training, you get a robust improvement in upper body strength, so the belly button above. This is primarily measured with a chest press exercise. So again, the evidence is very clear with high probability that you will get an improvement in upper body strength. And this might have applications for things around the house, you know, carrying groceries, getting out of bed, getting off the toilet, or getting out of a car. So again, I think this is an important reason. Interesting enough, though, that there is an improvement with lower body strength. It wasn't statistically significant. It approached it. But there's a reason why we think the lower limbs might be more compromised as we get older. So there's a couple new take-homes with this message here. So again, really robust, consistent evidence in the upper body. It's more inconsistent with the lower body. And I'll give you the next slide explaining why we think this is. So we were fortunate to do a meta-analysis, and we wanted to look at why was there inconsistent results from the belly button down. And we think we've come up with the reason. So when you look at the large muscles in the upper leg, the quadricep, these are highly engaged in really explosive exercises we used to do in our late teens and 20s, a squat, a leg press. We don't typically do those on a regular basis as we get older. And interestingly enough, that these muscles in the upper leg had reduced creatine stores compared to a young population. In other words, these very powerful muscles, which are important for longevity, seem to have a reduced amount of creatine at baseline compared to young muscle. So you might argue, wow, if they're already starting at a lower amount, maybe they need a higher dose than what's generally prescribed or for a longer period of time. And we showed in 2005 that, yes, lower limbs in the older population are more negatively affected. So if you were to put this into practical terms, I think for those that do engage in weight training, never miss leg day. Anytime you can take the stairs, do it. Skip the elevator or escalator. I know there's going to be a lot of discomfort with that, but anytime you can engage the lower limbs, that's going to have a huge implication for longevity and functional independence. And this piggybacked into some recent evidence to suggest that the addition of creatine to weight training will improve functionality. This is also another criteria used to diagnose individuals with sarcopenia. And we measured here the sit-to-stand test, so this is getting in and out of a chair more often. It did achieve statistical significance, not with high probability, but creatine did have favorable effects. So sort of when you combine the two or all three areas, it does improve lean mass, regional muscle mass. It definitely improves strength, primarily in the upper body. And now it actually improves functionality. And these are the three categories where we diagnose someone with sarcopenia, which leads to frailty. So again, resistance training is foundational, and creatine likely has some small favorable effects. Now, how does it work? We could spend 6 hours talking about the mechanisms. We think we have a little bit more insight, but I'll just talk about in a nice plain summary about what we think is happening under the skin. So this is the mechanisms we think are happening when it gets to skeletal muscle. And the way I like to preface this is, we could talk about all the cells and pathways and processes, but I would bore you for 6 hours. I think you really want to get the take-home message here as well. But if you do, or if you are interested in mechanisms, we did publish a paper in 2017, which is open access. You don't have to pay for it, and it goes through a step-by-step process. But the way I like to teach my students this is it increases anabolic processes. So think of anabolic steroids, although creatine is not a steroid, think of growing. So it seems to improve lean mass, strength, and functionality by increasing a number of really vital processes and pathways in the muscle. If you're familiar with satellite cells, these are cells that donate their nuclei to areas of trauma to increase muscle growth. IGF-1 is insulin-like growth factor. It's a growth factor involved in protein synthesis. And mTOR is a really fancy pathway that's involved in increasing the number of proteins within your muscle. So there's a series of anabolic processes, but interesting enough, it probably has an equal amount of anti-catabolic. And this is probably the area you're maybe more familiar with. It actually seems to have these anti-inflammatory or antioxidative stress properties. So similar to Advil or Tylenol that you take when you have a headache or muscle pain, creatine sort of exhibits some of these processes as well, which likely means you can recover from an exercise bout or muscle soreness quicker. So in theory, it has a synergistic or doubling effect. It has anabolic processes to kind of make the muscle grow a little bit. And maybe these anti-catabolic processes help recover the muscle. So this could have application for anybody that has heightened inflammation or other types of conditions that are susceptible, such as cancer, cachexia, or things like that. For those listening that are 40 above, here's a little bit of bad news. You obviously increase low-grade inflammation in your bloodstream after the 4th decade. So that's why things are a little bit more challenging to do. Things hurt a little bit more. Maybe creatine can help offset some of those effects. I wanted to preface some of the mechanisms or some of the areas of future research. So every one of those mechanisms we talked about have been shown to be viable and replicated in young individuals, but creatine has never been shown to increase protein synthesis directly. It sort of turns on all these things that are involved in making bigger proteins, but it's never been shown to do that directly. And sadly, the only mechanism that we have validated and substantiated in older adults 50 and above is that it increases creatine in the muscle. But all these other ones is still an area of question. So for any researchers watching, any grad students looking for a project, this is a great area to look at and provide a substantial contribution to science. So in brief summary regarding skeletal muscle, the combination of creatine and weight training has definitely been shown to increase lean mass. It improves, really importantly, lower limb muscle density, regional limb muscle size, And I put a star by strength because I think that's an important area for sort of looking at the effects moving forward over time. We transition now into an area that is very, very important, often underestimated and often forgotten, because when we look in the mirror, we see our body, but we never consider deep within the muscle bone tissue. And this is an area that has emerged. It's a very small area of research, but I think it's one that's definitely worth talking about. So we're sort of going to look at the small body of research looking at now creatine specifically on bone biology. So for anybody listening, especially young or perimenopausal biological females, they're more susceptible to bone-related fragility and conditions such as osteopenia or osteoporosis. So let's really see, can creatine not only have beneficial effects for skeletal muscle, also have some potential for bone. So we were one of the first labs to sort of look at the effects of creatine on bone. And you'll notice here again, we did the same dose as a previous slide looking at in muscle. But this was kind of a pilot study. We wanted to look at postmenopausal females. So these individuals had a cessation of their last menstrual cycle for at least 12 months. And some were on hormone replacement and some weren't, but we collapsed the data to look at 1 year of supervised weight training, 3 days a week, with a little bit higher dose than normal. So regarding skeletal muscle, 3 to 5 grams or more is very fine from a skeletal muscle perspective, but we think bone might require a little bit higher amount. And this was quite fascinating. The media got a hold of this. It was all on, went from a global wiring perspective to look at, because it was one of the first studies to look at bone mineral. Now, keep in mind, these individuals who are very susceptible to bone loss with the cessation of estrogen, they were taking about 8 to 9 grams of creatine monohydrate daily, in addition to 1 year of training. And you'll notice here that we looked at the change in the femoral neck, or this is essentially the change in bone mineral density around the hip region. And you're all familiar with, if you fall and suffer a hip fracture or need hip replacement, you're usually inactive for at least 6 months, and it does lead to premature mortality. So this was quite fascinating. Using DEXA, the aerial portion of the bone, the individuals who took creatine and weight training, they only experienced a minus 1.2% reduction in bone mineral. The people who took placebo and weight training, they experienced almost a negative 4% reduction in bone mineral. You'll notice that no group had an improvement. So again, there's no evidence to suggest that creatine increases bone mineral density. It will never, offset medication or offset osteoporosis. But it showed that by adding in creatine, think of those mechanisms, the anti-catabolic effects, it seemed to reduce the rate of bone mineral loss in the hip in a population that is predisposed to bone mineral density loss compared to placebo. Is this clinically significant? Well, we think it approached it because remember, the placebo group had minus 4%, and it's well known that a simple 5% reduction in bone mineral is associated with 25% greater risk of fracture. So we're not saying creatine increases bone mineral density. This study alone simply showed that it reduced bone mineral density loss. But I'm biased because that was out of our lab. It is important to look at the totality of all research. And remember way back before the slide on meta-analysis, we talked about, one study will say this, but you want to look at the total body. Well, this is where it gets a little bit of bad news if you had a lot of hope or hype for bone. When we looked also at bone measures in addition to muscle mass in that meta-analysis with 22 studies, unfortunately, when you combine all the data, creatine had no significant effect on bone mineral density in the whole body. It certainly had no effect from a femoral neck perspective. So the previous study was isolated. Here's our study here showing it had a reduction, but there's a lot of other studies that showed it had no effect. When you look at the area susceptible to osteoporosis, the lumbar spine, creatine again had no effect. So overall, we have to conclude that creatine will not increase bone mineral density. There is one study previously that showed a reduction, But now I'm going to show you a little bit better, more robust evidence, which we think has a little bit more application or weight when we come to it. So this was a second study to the previous one where we did 1 year of training, because we were slightly criticized by the government saying maybe 1 year of training wasn't enough, or the dose, if you can believe it, wasn't high enough. So we said, great. The government, the Canadian government gave us money. We looked at a really strong cohort of postmenopausal females. And then this time we gave 2 years of supervised training. This was 3 days a week of resistance training. And then we tried to achieve 150 minutes of brisk walking to really try to increase the muscle pull on the hip region. And then this was likely the first study to look at a very, very high dose in postmenopausal females. This was 0.14 gram per kilogram. So it approached about 12 grams of creatine monohydrate a day for 2 straight years. We got very hopeful, very excited, and then we look at the results. Again, this was with DEXA. So let's look at the creatine group. You'll see it's flatline. Even after 2 years of a super high dose of creatine, at best, creatine maintained femoral neck section modulus, which is an indicator of bone strength in the hip. There was, however, interesting, a decrease on placebo. So again, in other words, going back to the series of studies we've already showed, it's likely that creatine, if it does have an effect, it's an anti-catabolic. You can see here it just preserved bone strength, whereas those on placebo had a reduction. When we look at another measure, this is bone buckling ratio. We don't want to have a high bone. Oh, that didn't come up for some reason. Not sure what happened here, but this is a summary here showing that bone buckling ratio is an indication that if you were to see my pen and we would snap it in half, we don't want that. So all this is simply showing is that creatine actually maintained bone buckling ratio, whereas those on placebo had an increase. So again, suggesting that creatine might have some anti-catabolic effects or preserving those over time. Taking, in addition to the DEXA scanning, which is 2-dimensional, we wanted to use CT scanning again to make sure that we had a little bit more information on sort of what's going on in the bone, trabecular and cortical. And this goes back to the study with muscle density. And this was quite fascinating, and I'll sort of try to put it into practical terms, because when we look at bone area, sort of under the knee, we're looking at the tibia and fibia. Those that are taking 0.1 grams of creatine per day for a year, there was a significant improvement in distal tibia area and tibial shaft area. So now the bone sort of got larger. And if you combine that with muscle density, the theory here is that maybe if the older adult was to slip on ice or fall, maybe they would not suffer a sprain or fracture, which could allow them to maintain functionality a little bit later on. So we think there is something there. Future research needs to do a lot more clinical trials, but there is something there as well. And we think this is something to consider for the health care professionals watching, because bone strength and area are significant predictors of fracture. No study has ever showed that creatine decreased fracture compared to placebo, but that's a great area for future research. Could it also lead to falls prevention? 2 studies, the one from Brazil that I mentioned and the recent one that we did for 2 years. We did track falls an additional year after. Unfortunately, creatine did not decrease the risk of falls compared to placebo. But again, we need to do almost an epidemiological intervention to look at these individuals over the long term. From a mechanistic standpoint, very difficult to do a bone biopsy, but we wanted to sort of look at these anti-catabolic effects of creatine on bone. And we did a study in 2008 where we wanted to look at, could creatine reduce a marker of collagen breakdown in the bone? In other words, could creatine reduce something called NTL peptides? If there is a reduction, that means there was an anti-catabolic effect or a preservation effect from creatine in bone. And this was interesting because we simply wanted to look at this measure from an easy sample population. We looked at 35 healthy males. they were taking 0.1 gram per kilogram, so about 8 or 9 grams a day. And this was a short-term study in as little as 10 weeks of supervised training. And we were quite surprised because there was a 30% reduction in this urinary marker of bone breakdown by taking creatine compared to a non-significant increase in the males who took placebo. In other words, there's this anti-catabolic effect or bone preservation effect from creatine, even in a healthy population compared to placebo. So in summary, it's very interesting. It's similar to muscle, but there's a couple caveats. There's never been a study ever shown to have bone beneficial effects from creatine without training. So again, training has to be there, very similar to muscle. The dose is different. The lowest dose ever been shown to have bone beneficial effects, and again, there's only a few studies, was 8 grams a day all the way up to 12. Anything less than that does not seem to have the effects. So in summary regarding bone, it can have some small, very small favorable effects on bone geometric properties, primarily in the lower limb. It can decrease urinary markers of bone breakdown. If for those that are watching that are on a bisphosphonate, that's a pharmacological medication that is trying to preserve bone or reduce bone resorption. Creatine has been shown to reduce a urinary marker. But please note, there's no evidence that it increases bone mineral density. So at best, there's some emerging evidence that it might have some potential to decrease bone breakdown over time. So now we get into what I think is the hottest topic area. This is above the neck. It's kind of taken on a life of its own with some advanced imaging technology. And we never thought once that what a supplement was designed for bodybuilders or for athletes to get bigger, stronger, faster. Now could it actually have some brain health or cognitive effects? So the brain is small. Mine's the smallest of everybody watching. As I get older, it's atrophying, and unfortunately, it does go down. Very similar from a percent perspective, similar to muscle mass. But if you are healthy, had a great night's sleep last night, you're going to go on with your day. The brain is still very energy demanding. About 20% of your daily energy expenditure is going to the brain. And imagine if you're stressed, bad night's sleep, jet lag, sleep deprivation, the brain uses a lot more energy. And you know this because you're fatigued, you're relying on a lot of coffee throughout the day, it's just not working. So not only is creatine highly involved in brain bioenergetics, but that substantially goes up when you're stressed. So if you go back to the original part of the presentation, creatine is designed to help maintain the energy currency of our cell. And all your neurons use ATP just like your muscles. And when they need help, they're cycling ATP more. So the theory here is, could creatine supplementation come to the rescue when the brain is likely metabolically stressed? There's a big issue that's important to understand in addition or opposite the skeletal muscle. So your bicep or whichever is not making creatine, but luckily your brain is. So if you remember back in the diet, we can get creatine through red meat, seafood, or poultry. A small amount can be consumed, but thank heavens that this organ can synthesize its own creatine, because if you're a vegan and vegetarian, how in the world would you ever have creatine in the brain for normal neuronal function? Well, all the enzymes that are needed for creatine synthesis are in the brain. So this is very interesting. The brain can make its own creatine, but then there's a little bit of a nuance. If you remember the movie Star Trek and they have like a force field around you, the brain also has the very important protective blood-brain barrier. It prevents things from getting into the brain it doesn't want. So unfortunately, due to the blood-brain barrier, you can have all the creatine you want in the bloodstream, but it has a blunted uptake into the brain, mainly because one of the most important cells called astrocytes do not have the doorway or transporter. So think of your skeletal muscle like a vacuum. It sucks up all the creatine it can, where unfortunately the brain is like a vacuum, but the filter is very blunted or full. Some dirt gets in the form of creatine, but it's very slow. So maybe since the brain is making its own creatine, and again, it has the blood-brain barrier preventing it getting in, maybe you might need a different dosage of creatine to accumulate in the brain over time. Or here's a better question. If the brain is making its own creatine, does it even need supplementation, right? Before you heard about creatine supplementation, you were thinking, fine, doing well in school, maintaining activities of living. I think a more important question is, does the brain even need supplementation? Can creatine supplementation increase brain creatine levels based on what we just talked about? Well, the good news is yes, it can. This study was seminal. It came out of Germany. It was very elegant. They used MRS, which is an MRI for the brain. And this was quite interesting. MRS is about $650 per scan. So these studies are super expensive to do. And that's why the subject numbers are very small. But you'll notice in a population that was young, male and female, when you give a super high dose of creatine, 20 grams a day for 4 weeks, it did increase brain creatine levels, which was great. But you'll notice there's huge variation. Some increased by 3%, others increased by 13%. The average was 8% increase, which is great. They took it a little bit further, and then they measured regional and distribution amounts of creatine. And the good news is it did increase in the gray matter and white matter. So this is, the central and peripheral nervous system, and then areas for balance and function. So yes, supplementation can get into the brain. The dose here, though, was quite a bit higher. You'll notice 20 grams a day. That would be impossible from the diet. You would have to rely on supplementation. So going back to my question, yes, it can get in. That's great. And you'll say, Darren, you already talked about my brain is making creatine. Do you even need to supplement it to maintain activities of daily living? So this is where it gets into a little bit of context, and I think this is really important to take our time and go through. This study was out of Brazil. They used magnetic resonance spectroscopy, or again, the MRI for the brain, and this was more recent. They gave the same dose as the Descent study, last slide, 20 grams a day for 7 days. But you'll notice in children, healthy adults, and healthy elderly, there was absolutely no change over time. And you're like, well, Darren, how can that be possible? All 3 of these populations were unstressed. They had no chronic inflammation, no metabolic stressors. They were just a group of healthy individuals. And now, hopefully, this will make more sense. Even by giving a super high dose, since the brain has the blood-brain barrier and they were unstressed, the brain said, you know what? Keep all that creatine in the bloodstream for muscle or other areas. I don't need it coming into the brain because I'm unstressed. So for anybody listening, they're getting adequate sleep, proper nutrition. They're not relying on potloads of coffee throughout the day. It's highly unlikely even high-dose creatine will give you any noticeable effects. But then we get into areas where does increasing brain creatine content even matter? I personally don't know anybody on the planet that I've come into where they say, I haven't had a stressor in the last week. I think everybody goes through stressors on the run of a day. Your dog got up in the middle of the night, you had jet lag, you were late for work, whichever it is. I think we now look at the population, which is global, where they go through these stressors where maybe the brain says, I might need a bit of help. So if any of these look familiar, you're stuck in traffic for 2 hours, financial strains around the world. I mean, if you look at the cost of groceries and all those foods that contain creatine, super expensive, disease, trauma, concussion, metabolic stress, all of these things now open the door where creatine may help by increasing brain creatine stores. So the way I like to preface this is to give you a bit of a visual analogy. When you feel stressed, and I think maybe, there's a few hundred people watching, I bet you 80% of you would say, God, I feel stressed today. I think a student staying up all night, studying for exams. If your favorite sports team just lost, whatever it is, if you're flying to different time zones, the brain is likely, picture this, on fire. You're having stress in the brain from the mitochondria. You're having reduced creatine levels because the brain is using creatine so much. The thought is, could creatine act as an extinguisher to sort of dampen the flames? Could supplementation come into the brain and say, you know what, since you're going through a lot of stressors, maybe it could help? So the first area I want to talk about is memory. This is the most robust area when we get into aging. Now, keep in mind a little bit of detrimental news. As we get older, the brain is an organ. It does get smaller, just like our muscles do. So we're more susceptible to short-term, maybe long-term memory loss, forgetting simple tasks. Where did I put the keys? Forgetting daily tasks. And then you're susceptible to age-related dementia and Alzheimer's disease, things like that. So interesting enough, when you look at the data, when creatine is combined with exercise or without, so this is quite new. Remember, muscle and bone required exercise, but some of these studies had no exercise component. Creatine did have a very favorable improvement in older adult populations by improving memory. A bit of nuance, though, if you can see this on the screen, you'll notice a lot of these subjective measures were by only a few studies. And what's more disheartening is only a few of these studies actually measured brain creatine levels. So from puzzles to online games to whichever, at least we can conclude that creatine to an older population will likely have an improvement in memory. We just don't know what's causing the memory improvement. However, super excited to look at and talk about the recent novel results from Matt Taylor and Aaron Smith out of Kansas in the United States. They've now done a series of single-arm studies in Alzheimer's disease, so the global catastrophic effects from a neurological condition. And this was quite fascinating. I think if anybody's interested in dementia and Alzheimer's research, please take the time to look at these open access articles. They did not use a placebo group because ethically you would say, geez, this population needs a lot of help. Since they weren't doing an exercise arm, could creatine by itself have any effects? They gave 2 10-gram dosages split throughout the day to a population, 20 grams a day for 8 weeks, in a population 16 and above, diagnosed by medical practitioners with Alzheimer's disease. And this was quite fascinating. Every individual except for 2 responded very favorably by increasing brain total creatine. So now this is showing that, yes, this dose can get into the blood-brain barrier, likely because their brain was going through a lot of inflammation and needed help. And this was also fascinating. Keep in mind, Alzheimer's is characterized by memory and cognition loss. Not only did creatine get into the brain, but it was correlated in a positive manner by improving measures of memory, executive function, and cognition. So this has huge applications for anybody watching that works with clinical populations, dementia, or Alzheimer's disease. And the other thing here is they measured adverse effects. There was none. So again, even at a high dose over 8 weeks, it was very viable. We did a small study looking at stroke rehabilitation. Now, we did not measure brain creatine accumulation, but we did measure gait speed. And I think we were more interested, could creatine and weight training have some improvements in those that have suffered a stroke to improve their rehabilitation? And very happy to report that, yes, 6-minute walk test did significantly improve in those taking 0.1 gram per kilogram, or about 8 grams a day during 10 weeks of supervised exercise. So at the end of the day, exercise had a small effect. The addition of creatine, again, had an improvement. So for those anybody are working with any cardiac rehab or stroke victims, this could be at least something to consider. So to bring it all home from a summary perspective, you know, when you're metabolically stressed, jet lag, you stayed up all night, if you're, you know, graveyard workers, whichever it is, commercial airline pilots, I think in the military, the brain is working good, but sometimes it might need help. So therefore, creatine seems to dampen the metabolic stressors. There's evidence that it can have some neurotransmitter properties, but I think one of the biggest ones, it decreases oxidative stress, and it has these neuroprotective effects. So again, maybe increasing your dose on a little bit higher amount might have some application. I love this summary sort of because it sort of brings everything into perspective. So if you look at a preventative and then a therapeutic application, if you can see here on the screen, here's your sufficient amount of creatine in the brain. And then if you started to take supplementation, you'll see here you have a little bit of reserve. So when you go through those stressors, you're still at a sufficient marker. The worry for me is when you're insufficient and then you go through periods of stressors or take supplementation, that'll likely bring it up to sufficient levels. I will preface this is that your habitual dietary pattern, vegans and vegetarians, it doesn't seem like it affects your brain creatine levels that much because your brain is making. So at the end of the day, I think if you're going through a lot of stress, that's where supplementation will likely see some noticeable effects. But if you're not having any chronic metabolic stressors, it's likely to be ineffective. We've talked about the evidence. Now, what about safety first? And happy to report here that we've sort of looked at numerous randomized controlled trials, even at high dosages for up to 14 years. And compared to placebo, creatine has no greater adverse effect profile, compared to placebo there as well. So at the end of the day, since we're naturally producing it, it's metabolically excreted. The dose of creatine there and safety profile is very popular. So in summary, I want to bring this all home. The minimal dose of creatine in addition to weight training is 2.5 grams per day. I do think as you get older, for those 15 and above, you do likely need more based on that study we talked about in the lower limbs. I think if you want to go with 3 to 5 as a starting point and slowly work your way up there, that's fine. Regarding bone, remember the lowest dose ever been shown to have any beneficial effects is about 8 grams a day. And then when we get into the brain, we don't know much. The lowest dose ever been shown to accumulate into the brain and have effects was 4 grams a day, but that took at least 3 months in people with long COVID. So again, from a brain health perspective, a lot of inflammation. The best studies show that 20 grams a day is likely the sweet spot. So I've taken all that, and I personally take 10 grams a day or more because that'll check all the boxes for muscle, bone, and brain. But when I know I'm flying overseas with multiple time zones, I'll take 20 grams a day a few days before, during my travels, and a few days after. And I've really noticed an effect there. I'm an N of 1, but that's where this, if you hear about 10 grams a day, it seems to be a good average dose. Again, no adverse effects there as well. Please take it on a daily basis if you are considering supplementation. Again, if you have any pre-existing medical conditions, please talk to your medical practitioner before you do take creatine. But we think daily supplementation is ideal because then it can go to different tissues throughout the body. And one other question we often get is, does the timing matter? Good news, no. You can take any or creatine at any time that's convenient for you. So I like to preface that creatine is just simply one tool in the toolbox. It's simple, it's safe, it is effective, but please put it in context. It's not going to be a cure. You still have to do the work, but I think it definitely has some applications moving forward. And so that wraps up this part. I want to thank you for your time. If you want to follow me on Instagram or Twitter, there's my handle. If you have any specific questions with that as well, and hopefully you enjoyed the webinar.
So thank you very much for your attention. We'll now go into the questions. And I see there's a lot of interest in detailed questions coming in. For sure, we're not going to be able to answer every single one of them, but we are going to do our best. So everything we can tackle now are going to be answered via email. So Professor Candow kindly volunteered to give us his insights then. So I will start with one question that was voted quite highly. Does creatine absorption vary among individuals, and what factors might influence this variability? And how can one determine if creatine is being absorbed effectively or non-effectively in the body?
Yeah, creatine is very unique. It's the bioavailability or absorption is about 100% from a monohydrate perspective, especially. So even the hydrochloric acid of the stomach, it's actually too acidic to break down creatine. So it's quite unique. It actually gets through our small intestine into the bloodstream. So the absorption or bioavailability is near 100%. Some people say, is there anything else I can do to get a little bit more into the muscle? You can combine creatine with protein or carbohydrates. That seems to have a synergistic effect there. We don't know about into the bone or brain, but at the end of the day, the best way is exercise. Exercise sort of stimulates the doorways that allow creatine in. So if anybody said, what's the best way to get creatine into the body? I say, well, first consume it and then add it with exercise.
Great, thank you very much. One other question, or maybe two different questions, go in the area of people struggling with overweight and obesity.
Yes.
So is there any advantage of creatine supplementation in people using GLP-1 drugs or post-bariatric surgery patients?
Yeah, we just put out a paper. It's in press right now with the theory that creatine could be used for people with GLP. So remember those mechanisms, the anti-catabolic effects. When you take GLPs, there's a substantial weight loss, and we think some of that is lean mass. So since creatine can offset lean mass loss, we definitely think creatine added to GLPs with exercise could be something there to not only maintain lean mass, but an area that I didn't have time to get into, creatine has actually been shown to promote fat loss. So those individuals might get an extra increase in fat loss there as well. So there is a lot of application, and a good colleague of mine at the University of Saskatchewan, Dr. Phil Chilbeck, is now recruiting subjects that are taking GLPs and looking at could creatine have some advantageous effects there as well. So yes, there's a huge possibility. We haven't had a clinical trial, but it is coming. Yeah.
Great, that's super interesting, especially on the clinical trial that's coming.
Right. Yes.
Women's health, that's also a big topic for everyone here. And there's a question on, have you done the creatine plus resistance training on potentially pre and perimenopause women, so not the postmenopausal woman, where you could potentially make a greater difference even before they tackle the menopause itself?
Unfortunately, pretty much no. Dr. Abby Smith-Ryan from the University of North Carolina in the United States has looked at that and sort of looked at different phases of the menstrual cycle. And I believe she's actually sort of looking at that right now, specifically looking at perimenopause. We're going to be looking at an exercise training program at our lab on perimenopausal females as well, but we have nothing on really young premenopausal females, looking at measures of muscle, bone, and of course cognition into perimenopausal. So huge area of research, always overlooked, and it's the area that we definitely need to focus on. So unfortunately, there's minimal to no evidence there as well. From a pregnancy though perspective, going way early, Dr. Stacey Ellery out of Australia has looked at it in the animal model, and she's doing now a randomized control trial looking at pregnant females. Can creatine help improve brain or bioenergetics for the female? Could it transition into the breast milk once the fetus is born? So these are areas that are crucially important, and it's a very emerging area.
Oh, great. I think you already went into the next question, which is, are there any recommendations to use creatine postpartum? And I hear you now that it's emerging evidence, but probably not enough, or anything to add?
Yeah, I think that's fair. I think, postpartum is some of the characteristics is cognitive effects, the brain fog, muscle loss if you're inactive, things like that. So creatine could help, but there's never been a study to look at specifically. But again, it might have some application. It certainly won't hurt, but it could be something to help spark plug the exercise program after the child's been born. Yeah.
Great. Thank you. There are some questions on contraindications. Are there any contraindications? For example, is there any side effects like hair loss or diarrhea we've read here?
Yeah, so if you look at me, if they can see me, I mean, that's the one I get all the time. I was going bald before creatine. So a study came out on hair loss, and they looked at cross-sectional area a few years ago. And at 5 grams a day in biological males, there was no evidence to that. And that's one of the biggest myths based on a hormone from rugby players 2 decades ago. But from a contraindication perspective, where creatine goes through and is synthesized in the kidney and liver, for those that have pre-existing medical conditions focusing on the renal or hepatic system, always get medical clearance. Or if you have any other conditions that you're unsure of, please get medical clearance before you take creatine. But at the end of the day, we've seen no adverse effects from many populations. So it's very hard to look at contraindications except for pre-existing medical conditions.
Okay, that's good to know. So basically, when we go to the question of creatine indicated in hemodialysis patients, you need to go to the actual doctor and check with them.
Yes, but an interesting thing is even with chronic kidney disease, the kidneys use creatine almost as an essential compound. The interesting thing with creatine is osmotic, so it likes to retain water. So it might actually have some applications for maintaining blood volume. But again, as you mentioned, if you're on dialysis or any other types of renal issues, please get medical clearance there as well.
Great. We also have a question on cancer patients. Is it useful or contraindicated even?
No, it is useful. Mark Tarnopolsky put out a great section on paper recently. So unfortunately, with many types of cancer, it's catabolic. Therefore, you go through an excessive amount of not only bone loss, but of course, lean tissue mass and functional improvements. And so creatine can be used as a toolbox. We are now looking at that with breast cancer and prostate cancer with a colleague in South Carolina. So hopefully we have the results shortly. But the other big thing is where creatine is anti-inflammatory or anti-catabolic, that's where we see creatine to potentially have these anti-cancer properties. So that's an area of huge interest, and I can't wait to see some of these randomized control trials to come out. Will it decrease tumor expansion, metastasis? We don't know per se. In animal models, there's some mixed evidence, but again, at recommended dosages, creatine seems to hopefully have some positive effects by being anti-inflammatory.
Great. It's good to hear that much evidence is still in the pipeline and coming.
Yeah. Yes.
Do you have evidence of creatine uses in traumatic brain injury patients? I think you mentioned a little bit in one of the slides, but can you elaborate a bit further?
Yeah, there's only been 2 areas. So in mice and rats, when these animals took creatine before or after a head trauma, their symptoms of recovery, cortical damage, definitely improved. And then the only human study that have looked at concussion, this was actually in children a few years ago. They gave 0.4 grams per kilogram, so a pretty high dose. But again, these individuals were a lot smaller. They didn't measure brain creatine after concussion, but they did measure from 3 to 6 months self-care and subjective measures of speeding up symptoms of concussion recovery, and it did work. But we need that randomized control trial looking at how the brain is now, unfortunately, after it gets head trauma or concussed in athletes, and could creatine speed it up. But I think if anybody's watching that's involved in head contact sports, the evidence is clear out there that creatine can only help. It's not having any adverse effects. So football, hockey, whichever it is, creatine might have a prophylactic effect by, if you're in a sport that's involved in head trauma or contact, maybe creatine will speed up your rate of recovery. It won't prevent it, but maybe it'll just dampen the amount of head trauma, which could have profound beneficial effects.
That's super interesting. Great. So we have a question on the regulation. What recommendations can we draw from the current evidence on brain health? What are your thoughts on brain health claims that are permitted in Australia but rejected in Europe? I know it's hard to answer because usually authorities in each region work quite differently, but maybe you have an idea on what to say to that.
We really need to tone down the overhype on the brain for a specific couple of reasons. So remember, of all the data I showed you, only a handful have used imaging to see where creatine actually accumulating into the brain. The vast majority of studies out there that suggest creatine is a cure, it's substantially not. So again, I think we need to tone down the hype until more studies come out that yes, creatine can get into the brain. We now need to know what parts of the brain is it going, the reliability behind it, and then does it cause some long-term effects? So I would suggest the next 20 or 30 years will primarily be focusing on the neck up. There is emerging evidence, there is some evidence, but I think we need to tone down our expectations on the brain especially. We just don't know enough to conclude, hey, it's going to be a cure for Alzheimer's, Parkinson's, things like that. The evidence is there. I'm super excited about it, as you can probably tell. I want the next 20 years to really focus on clinical trials, but until we get that data, I think people can say it might help, but I think the best lines is when you're really stressed. If you know you got a student listening and they have final exams and they're not going to sleep for 30 hours, or an ER doctor, that's likely when you're going to notice some effects. But if you're healthy and happy, you probably won't. So it is context specific.
Okay, that's good to know. And probably those areas where you mentioned where people actually had a stroke and are recovering, and really an incident which decreases the stores.
Yeah. And the other area I didn't want to put up here because it didn't fit, but clinical depression. Some really good evidence from Utah in the United States is showing that the addition of creatine to SSRIs or methamphetamine use or CBT can have a synergistic effect. Not saying it replaces it, but again, clinical depression, Alzheimer's, they're all common denominators. Those populations have reduced brain creatine levels because the brain is so inflamed. So by adding in a supplement, maybe it'll bring those levels back up to normal or even higher. So again, in populations where stressors are common, that's where supplementation likely would have an effect.
Great. That's super interesting, and I think also an area where many people are affected.
Yeah.
So
Yeah.
really useful. So when I look at the time, I'm afraid our time is out. Thank you very much for your valuable contribution here and for really giving us an overview of creatine. I know you can probably talk for hours on this topic.
Yeah.
Maybe we can invite you back one
Sure.
occasion.
Yeah.
And to the audience, the recording will be available, the slides will be available, you have the additional resources, and Professor Candow will mention or try to answer your additional questions as well. So thank you very much. Special thanks to you, Professor Candow. And with that, I wish every one of you a good day, a good rest of the day, and thank you for your attendance.
Thanks, everybody. Thank you.